Hey!
Hi, this is Dr. Christine.
And Dr. Colin.
And we are your co-hosts for the exciting new podcast called
Love, Scrubs, and Stories,
where we dive deep into the world of dating and relationships and go beyond the people wearing the white coats, the scrubs, and the stethoscopes.
Come join us on this journey where we engage in dialogue and share stories of love, heartbreak, resilience, and triumphs. And we also navigate our professional lives with our hearts on our sleeves.
Please remember to subscribe and hit the notification button to stay up to date on all future episodes.
And we look forward to seeing you inside. Hey everyone, what's going on? So welcome to the Love, Scrubs, and Stories podcast. I'm your co-host, Dr. Colin Zhu, or just Colin from now on. And this is...
And I'm your other co-host, Dr. Christine Nguyen, or just Christine. We are so excited to be here today, and we have an exciting topic and guest expert to share with you all.
Yeah. And, this is if you're just tuning in, you're just finding us, off of, some algorithm that you found off of your, favorite podcast. This is a podcast, meant for single and or, healthcare professionals that are in committed relationships. And whether you are in love, looking for love, or anywhere in between, we want to be able to have you guys. And so we're going to have a lot of fun. Today, we have a brilliant guest expert. But before we introduce her, I want to know, Christine, when was the last time we talked about STDs and STD testing? And, is it important to talk about, right? Like you and I, let's just say we're, a scenario, right? We're dating, right? First time date, when is it appropriate to bring up that question? Do we do it from the get-go? Do we do it during dinner? Do we do it while we're intimate? Like when do we actually, bring it up?
Very, very good questions, Colin. Exactly. It's like there's this, we talk about it to our patients. It's like, do we apply that? I mean, do we follow our own medicine is the question also, right? Is what you're saying. And so there's the what we should do, right? And then there's the reality of what actually happens, like those photos of like, what you do, how people see you do it and how you do it. It could be very, very different because there's, we have different identities. We are healthcare professionals, and we are also single out in the dating world, dating in the wild or dating online.
In the wild.
And when we're out in the wild, do we follow our own medical advice, right? Very, very good questions. And
let's talk about this. When is the appropriate time to ask?
When is the appropriate time? I don't know that there's an exact answer per se. I would say, as with all things, right? I hate to be the one to say it. It depends, right? So what is the dynamic like between, you and your date? Where are you at in the relationship? And are you at, the screening phase, the date 0 or the date 1, or how far along are we, right? I mean, let's be real about
screening
this.
Phase.
Screening phase. So
everyone comes through like a filter, right? Everyone comes through a filter of screening.
And what is your comfort level, right? We're all different in terms of how we approach dating and relationships, and from there, it also dictates, how we go about in discussing STDs. And the whole topic of intimacy, right? Because that's essentially what we're getting at is the intimacy part. And at what point do we bring that up? And I'm a huge proponent, and wholeheartedly agree that it's very, very important for STD testing.
Right. And I'm also very curious on, like we said, or asked before, like, do we practice our own medicine? So I would love to ask, our guest expert, are there any data or anything that you see of us following our own medicine? Do we do our own checkups as well? So, Christine, you're also the founder and host of your own community, White Coat Romance, and you have a flourishing community. Was that a question that was posed in the chats? Do you know offhand?
Yeah, we don't, there hasn't been an exact poll per se, although that is a good idea, but we do talk about STD testing through different posts and comments and subthreads and so forth that ask in terms of what's everyone's comfort level with that. Because the question becomes like, are you the type of person that is like going on a date with papers in hand, right? Or do we ask for everyone's papers, right? Now, I mean, we're asking what everyone's COVID status, vaccine status. In the beginning, it was more the issue. Wherever you went, you got to carry your papers, right? And are we carrying our COVID papers? Are we carrying our STD papers with us on a date? And at what date number, right? These are the reality of like, are we there? And is the concern of that being an issue in terms of how we approach a relationship? And it just seems like, it's tricky, right? And it really comes down to some, very personal, like beliefs and personal comforts as far as like how you feel about intimacy and what's the importance of finding out someone's like STD status. And so I would love for our guest expert to kind of fill us in, because I would love to hear the latest guidelines on where we're at and what the recommendations are. And from there, then I think it's up to each one of us to decide to our comfort level and kind of where we're at in terms of how we want to approach dating when it comes to intimacy and the importance of STD testing before that happens, or wherever you're at.
Yeah. I agree with you. I think it's a number of factors and variables. It's timing. It's, the accessibility. Nowadays you could actually just go on a website, order what you need to order. The box comes in, you do your thing, right? And you send it off, and, it totally cuts out going to the doctor, having some sort of, screening evaluation. And then, it just, a lot of time has, been cut out. And, I think that's, been great as well. So let's introduce our guests. So her name is Dr. Tulika Singh, and she is an infectious disease specialist. She is here in Orange County, California. She's affiliated with the UCI Medical Center. She has received her medical degree from, I'm going to butcher this, Kasturba Medical College in Manipal, India, and has been practicing for more than 20 years. She's board certified as an HIV specialist, infectious disease, and she is she's also principal investigator in several clinical trials as well, and she's also working as a staff physician at UCI. So, and Dr. Christine, would you like to share some of her hobbies to get to know her as a person, because she's a person and a human being?
I mean, obviously she's highly qualified. Dr. Singh also loves to travel to Mexico and other exotic places, enjoys the outdoors as much as she can. She finds peace with mindfulness through Pilates, yoga, and meditation, all really wonderful things.
I love it.
Now, shall we bring her on?
Yes, let's bring her on. So,
hello there. Hi, Dr. Tulika Singh. And thank you so much for joining us.
Hi,
on
Christine.
the Love Scrubs
guys?
podcast.
Thank you for having me.
Thank you so much for coming on, taking the time out, and So, are you calling from Southern California right now, or are you traveling out and about right now?
I'm actually home right now, so I am calling from home.
And you look amazing, yeah. So you are.
So I hope I just watched it.
Yeah, so you're not only a guest expert, but you're also part of our White Coat Romance community. So we're really excited. And I'm always like perplexed. I mean, like, look at you, Tulika, you're gorgeous. Like, what's going on with the men out there? Like, do we need to page our ophthalmologist colleagues and make sure that they get an eye exam, or what's going on? How's it going for you?
They probably need to get their own eyes checked.
I don't know what's going on. I think there is definitely a wave amongst women, also, physician or non-physician, to kind of take our time in vetting our, prospective potential partners, and take our time and not rush into a new romance, guilty. Like I used to like wear my heart on the sleeve, and like I would fall in love so quickly. And, over time, I realized that, the more time you spend in the beginning is better than take your time. What's the hurry? And so I think that's what's going on. I think people are taking their time.
Yeah, it is good to take your time, because, at this point in our lives, I think we hopefully all have a pretty good idea, know ourselves pretty well, in order to be able to find that compatible partner. So, but we would love to take advantage of your expertise.
Oh, before that, we
That's
like to start
right.
off. We like to start off by asking, "What is your pickup line?" Okay, and we prompt this, before our guest comes on. So, Dr. Tulika, we are in the coffee room. We are in the doctor's lounge, and you just came off of a, shift. I'm just starting a shift, and you approach me, and your pickup line is,
Oh my God. I'm gonna keep it in the vicinity of my infectious disease world. So I would say, well, Colin, you can't spell virus without U and I. So we both get tested.
Yeah, I love
That's
it.
a good one. All right, awesome, perfect, and it's so
Awesome.
perfect, especially for you with your specialty.
I love it. I love it. So, Christine, why don't you start off the first question for our amazing guest expert?
Yeah, so Colin and I were just talking about just the importance of, STD guidelines, STD testing, and, when it comes to relationships and intimacy, and that's something that we, educate our patients on. And the question becomes like, how many of us as healthcare professionals dating in the wild actually follow our own advice that we apply to patients? And part of it is, being also up to date. And we would love to hear, and our audience would love to hear what the latest STD guidelines are to start.
Well, thank you for that question. So I think we on the straight side can learn a little bit from the gay side when it comes to online dating. They actually have apps, dating apps, where they have their, different STD, STI, HIV status that they can actually highlight on their apps. And there is a way that they can match with, if there's an HIV positive community in dating side, they can actually match with HIV positive community. So they kind of are a little bit ahead in the sense that they do not have that low stigma when it comes to dating with STIs. As much as we on our side see that, it's definitely a taboo topic. It's definitely stigmatizing. If somebody had it, like, if your girlfriends are talking and somebody got something, it's always like, oh my God, don't tell anybody, but this happened to me and stuff like that. So there's definitely more stigma on our side. What I would say is, like, if you look at the epidemiology of these STIs, they are actually not going down. So obviously the MSM gay population has more of it, but in the straight population as well, this is definitely going up. Syphilis, especially, and chlamydia are two STIs that are rising in our population. And some of it is because not getting tested and diagnosed. And then second of it is like not getting treatment or completing a treatment because of stigma or whatever. So one of the things that I do in my practice clinically is definitely ask every patient their sexual history, right? It starts with the sexual history. How many of us are even comfortable taking that? I literally went to school for 2 years to learn how to take sexual history and ID fellowship, but I know, like, we don't spend that much time in our primary care. It's like we have to do 500 different things, and sexual history is just like how much time we do even have. But, always start with the sexual history. Start taking sexual history with your patients. Take sexual history of your partners, of the people you're dating. And it doesn't have to be the clinical way. I know we're doctors. We might not be dating doctors. We might be dating outside our community.
So how would you, if I may ask, Dr. Tulika, how would you go about approaching that topic? Because it's always a sensitive topic, even for healthcare professionals when it comes to dating. How would you, what are your recommendations on how to bring up that topic and how to open up that conversation
with finesse?
Okay, good question. So obviously I don't do that on my first date, right? It's like, for me, like, sex is so far away from the first date. First date is just about learning about them and like just the basic stuff or the previous relationship, like, just kind of getting to know them. I definitely start hinting about sexual history and sexual, STI testing more in few dates down, where I am thinking like, okay, this is going to be something that I'm going to potentially become intimate with this partner. And at that time I say, hey, listen, this is kind of like my rule that for myself, for safety as well as my partner's safety, that I always get tested for all the STDs. And okay, there's an STD and STI word. Like a lot of people are like, why have the ID doctors started using STIs? So this is like a recent change. STDs, sexually transmitted diseases. STIs is sexually transmitted infection. We were bored, so we decided to just change the terminology because we were like, not all infections actually lead to disease. Some are just there. So we can just actually technically call it infection. So STIs versus STDs. So you'll see me use STD, STI kind of almost interchangeably, but the real new term is STIs. So just another.
Good to know.
Thanks for the explanation.
I know, because it's like, why is she saying STI and STD sometimes? So that's
just
like,
because we need more acronyms in our heads,
right?
And more, name changes,
it's
right?
Just a board in a meeting.
We got to sound smarter, when we're out in the wild and just throwing acronyms out left and right.
Yeah, it's like, hey, can you get tested for STIs? And your partner is like, what is that? I don't know what that is. But yeah, so I would definitely lead by example. So I said, I want to get tested. And I would love if you would get that too. And here's a list. So I have a little.
So do you have like a list? Like you have on a business card?
Wait, is it like a scroll that you just like like just let go and go?
Should we be handing out these business cards for prospects?
It's saved in my phone. It's something that I will just text, and it's like. Basically, the basics, like the hepatitis B, hepatitis C, HIV, and those are on the virology side, and then the chlamydia, gonorrhea, and syphilis. Those are the 6 things to check, because in males we don't check for trichomonas, we don't check for HPV. There's some age guidelines too. I'm not dating anybody under 25, but there's some age-related guidelines with STDs. Under 25 that's recommended, over 25 it's not recommended. So stuff like that. So I do have a little. I'm happy to share with you guys, but basically hepatitis B surface antigen, HIV antigen antibody test, hepatitis C antibody. And then for syphilis, the RPR is good enough. And then gonorrhea, chlamydia, urine testing. I don't want them to hate me and getting a urethral swab because we have more advanced testing now. The NAT testing is actually available in urine, so they don't have to injure their penis and get this testing done. It's pretty painless.
That is lovely to hear.
I mean,
the Love, Scrubs, and Stories podcast is a collaboration and co-production between the Chef Doc and White Coat Romance.
The Chef Doc is a wellness platform that offers innovative approaches to thriving and offers a self-empowerment book, podcast series, on-demand masterclass series, as well as a brand new app. The app provides self-guided education such as food as medicine, self-care, and resilience. Coaching services are also available, whether you prefer one-on-one or group type settings. Please go now to your app store as well as Apple as Google Play to download for free.
White Coat Romance is a dating app for healthcare and health-related professionals and students in the US and Canada. It's a lively space where you can find love, companionship, and build meaningful connections with like-minded professionals. If you're single, go to the App Store and Google Play to download and join our vibrant community.
As we both serve these amazing communities, we also acknowledge the value of continuing education. Therefore, we're super excited to share an enticing opportunity with our listeners. Our episodes are continuing education eligible. That's right. You now have the opportunity to earn valuable credits while enjoying our content.
Rest assured, the episodes will always remain free as we are committed to supporting our communities and amplifying the voices of healthcare professionals. To get a better understanding of how this works, the first 3 episodes are free to obtain, then the rest of the podcast episodes are at a nominal cost.
So you might be asking who can earn credits? Well, physicians, nurses, nurse practitioners, physicians associates, pharmacists, dentists, as well as dietitians and dietetic technicians.
If you find yourself in need of CE credits, we kindly ask you to consider directing your CE funds towards supporting our cause. Your contribution would greatly help us nurture our podcast production and continue to bring you valuable content.
We are deeply grateful for your support. From all of us here at Love, Scrubs, and Stories podcast, thank you so much for choosing us.
And enjoy the rest of this episode.
I mean,
and what's your take on HSV? Should patients, anyone who's single, who's wanting an STD panel test, should they be asking for that?
That's a great question. So the guidelines are a little bit torn when it comes to HSV. So the GYNs are very good at that. They will do that. They think like when the baby is coming out, they need to test the mother, make sure that it HSV1 or 2, whatever is, they just want to know. But for infectious disease, our community don't recommend HSV testing as part of screening. But if somebody has had an HSV herpes outbreak in the past, it's not easy to tell your partner that, oh, by the way, why don't you throw in an HSV testing too? Because I had herpes. Like, no, people are not going to say that. But there are some legal implications of that. There are some states where it can be something that you don't divulge, and it can be a legal implication. It's going to be hard to prove that in court, but at the same time, it's just like you can always tell your partner, it's like, by the way, I didn't get the HSV testing. I'm not requesting it from you, but this is the panel that is recommended for testing in everyone and anyone. And HSV testing, if you want to, Christine, if you are like, okay, you know what, we're getting all these 6 testing, why not just HSV also? Request that and get yourself tested too. And if you already have got it tested and you know your results, you can always share that or get it tested again. I believe in it being a fair thing. So like if I'm requesting that from my partner, then I'm also getting that done.
Gotcha.
But yeah, more towards when it comes to getting to where, there will be fluid exchange level and not like, besides, if I get it now, like
you're talking about sharing drinks.
Yes, exactly. That too. Yeah. Well, that was from the first. Oh yeah. Okay. Yeah.
Okay. So in terms of dating, switching it back to dating, right? And let's just say you're dating a non-clinician, right? And your timeline, right, is like far out. You just mentioned. So what if the opposite person, I don't know, wants to speed things along and let's just say, happenstance, rhetorically speaking, you are okay with that. Do you speed up the process? Do you wait until, you get everything back? Like, how does that conversation, for those that, let's just say, something happens, right? And things are a lot earlier than expected. Like, how does that conversation would go?
I mean, always wear a condom, right? Condoms can be worn from the first date. You don't have to wait for the test results. Test results are more, for me, at a point where I'm ready to be in a relationship where if there's no risk of pregnancy, that we are not going to be using condoms because we're going to be both monogamous or whatever the understanding is, when there's going to be exchange of fluids. And so that's why at that time we want the results back and want to see that it's negative before you expose yourself or your body to without barrier. But always from condoms, from date one, you can go ahead and the test can be brewing and results might not be back. But yes, but condoms are very important too. Even when you have the test result, unless you both are really ready to, not use condoms, that's when those tests are definitely going to come in handy. But if they want to speed it up, you got to get the testing. And you can always say like, okay, I understand that you are on this timeline, but I'll feel most comfortable if I get the test done by you and me and have the results back, or at least get the testing done.
Mm-hmm.
And in your experience, how has that conversation gone for you and the response been for like this type of request?
It's always, I feel, and now I could be just generalizing us, but it's always the man who wants to speed things up a little bit. And we're a little bit like, no, what's the hurry? Let's just see where this goes.
Let's just see what the test results are.
Yeah, let's just wait for the results. But yeah, it has happened previously. And I just basically told them like, hey, so I happen to work in an STD clinic, so you can get tested tomorrow. There is no lines here. This is
I would promise to not, clock in when you come.
Not to look at your results because of HIPAA. But yeah, if you want to move that fast, then go get tested tomorrow.
It's quite accessible. They can go to an urgent care.
The county clinic. We don't have to wait to see your doctor to get these tests done. Like, you can just go to health department and all the STDs, HIV testing is free and done at the health department.
And Tulika, the ones that you can just do online, are they just as effective, do you think?
Yes. So the technology has evolved a lot, especially with the COVID times. You actually can get home testing for HIV or a quick test, and it is 99% effective. So those tests are effective. I mean, if you don't collect the sample well, or I mean, there's always the human error part, but the test itself is good. Because we did in COVID times, we were sending our patients who were not able to come in or were scared to come in because of COVID, we were sending them the STD testing home kits. And they were returning back and we were finding them positive also. So they're pretty effective.
Okay, so going back to what you were saying before in terms of the rising rates, was that during post-pandemic, during that time frame, or was it even you found that before the pandemic started?
Good question. So you know what? We definitely had lower testing during COVID times. So some patients, if they can't come in the clinic and, we were sending this to home, sometimes we would never get the kits back, so when they were there in clinic, we're definitely testing them. So definitely the testing rate had gone down during COVID. So when the COVID ended and everybody started coming in, we just saw like this surge of STIs. And I think it has something to do with not being diagnosed on time and then coming later and being diagnosed. So I don't think people stopped having sex during COVID, to be honest.
I kind of feel like they had more sex.
You know what? They were, yes.
Or breaking up. They're either having more sex or they're breaking up more.
Or breakup sex. Right? Any of the above?
Yeah, and breaking up doesn't mean really more sex, actually.
There's makeup sex, right? There's breakup sex.
But yeah, no, I really feel that the sex part didn't stop necessarily in pandemic. It might have slowed down, but then I think it might even average out, to be honest.
Yeah, and how often do you recommend STD testing? What are the guidelines?
Relationship. I mean,
with
like
every new relationship.
Every new relationship. I mean, I personally, I do it before and also after. Sometimes, after, like during the breakup, after the breakup, there's a loss of trust there, and there's a little time period, before a breakup when things are not well, things are not going right. And then, sometimes people will act out of their character or sometimes out of spite or whatever the reason is. So I always get tested before a new relationship as well as after.
Great recommendations.
Because it's a very good question, because every organism comes about at their own timeline, right? So, yes. But, instead of, to me, in my head, I would want to chase every single timeline and just make it fall in line. But you're saying just do it before and after, after every encounter.
I would even do, to be honest, like I am HPV vaccinated, and we call it the STD vaccine. So hepatitis A, hepatitis B, and HPV vaccines, we call it the sexually transmitted disease vaccines, prevention vaccines. So definitely get those vaccines done, not for yourself. Also, like if the partners, a lot of older partners who might not have had the hepatitis A and B vaccine, but always recommended, why not protect yourself from hepatitis virus, especially if you travel to Mexico or something, you get hepatitis A, from foodborne illnesses. And so get hepatitis A, hepatitis B vaccine, and HPV vaccine. But now, if you did not get HPV vaccine and you are having, a new partner, you are at risk of getting HPV. Definitely get yourself tested as a woman. Get yourself tested with your cervical pap and HPV testing smear done, because you might have acquired HPV infection with this new partner. And there's no other testing for HPV other than actually, with cervical pap smear HPV testing. There's nothing for males. You just find out when you get a genital ward or cancer.
Like, oh, hello.
Oh my, yeah. I'm really glad you brought up.
Also, it's not just the cervical cancer, right? Or the warts. Oral cancer or pharyngeal cancer is now coming up, and a lot of HPV, cases are coming up with just oral pharyngeal cancer. It's from oral sex. So the same HPV virus, oral genital, connection. So it's the HPV vaccination, like now is approved till 45 years of age. A lot of us are in that age group. Definitely get the vaccine, whether you're a male or a female. And then also, if you say like, well, I might have been exposed to HPV already and I got an HPV testing done and it was negative for a woman. Well, guess what? The vaccine has way more serotypes and covers way more HPV types than what you would have acquired, in nature as an infection. So definitely vaccinate yourself and get immune to those serotypes that are actually in the vaccine, HPV vaccine. So definitely recommend it. If you haven't got the vaccine and you think like, oh, I'm too old to get HPV, just get it if you're 45 and under.
Can you briefly go over sort of the recommendation on how, timeline wise and how that works?
Yeah,
Just to bring everyone up to speed.
HPV vaccine was considered an adolescent vaccine, right? So children like from ages, so this is supposed to be before sexual initiation, because even with one intimate experience, you can get HPV. It's one of those viruses that just transmits with one experience, right? So the idea was to get our children vaccinated so that if they get exposed to HPV from their first sexual experience, they will be immunized against it. So you start at age 9 years of age. And you know what? It seems very premature, but to be honest, like there's a lot of kids, they are getting sexually, initiated that early. And so it's a great guideline. It was great. But what they did not think of is the other spectrum of the age group, because a lot of us also did not get initiated that early, and we started having, not all of us are partnered by age 26. So it was like from age 9 through 26. That's it. That was the age range. After 26, don't worry about it. You've already been exposed, so no need to get vaccine. So that was the initial guidelines. And then they realized, like, wait a minute, people are getting divorced. People are finding new partners. If they didn't get HPV from their previous partner, these new partners after the age of 26 might still be transmitting. And then there was a lot of studies done, and the data showed that yes, adults over age of 26 who have not got HPV or not got a different type of HPV can actually benefit from the vaccination up until 45 years of age. Now, I think is like, now, some of us are over 45 years of age and are still getting exposed to new HPV potentially carrying partners because, there's no upper age limit to stop dating. And, we have, even in our WCR community, we have older, members who are still dating and who are still trying to date and, find partners. So like now we're going to deprive them of getting the vaccine because they're not 45. So to be honest, like I know the insurance will cover till 45, but if you haven't been diagnosed with HPV and you are at risk by having new sexual partners, I would say just extrapolate that and get vaccinated. You might have to pay out of pocket, but I'd rather pay out of pocket than get cervical cancer, to be honest.
Yeah, very, very good points. Thanks for mentioning all those things. So let's kind of walk, us through this. So you get one dose today, and then what is the recommendation on the follow-up?
So if you didn't get it till 26 years of age, then it's recommended to get 3 doses. So if you got it when you were younger, you can only get away with 2 doses. But like when you are over 26, you have to get 3 doses done. And if you started so 0 and 1 month, 1 to 2 months, and then 6 months. So that's the regimen. But when you actually, if you started that, you got the first dose, you got the second dose, and life happened, you forgot about it. The next one was going to be in 4 or 5 months. You forgot about the third dose, and then 3 years later, you realize, I'm like, oh my God, I didn't get the third dose. Just go and get the third dose. You don't have to restart the series.
All really, really great information. Thank you so much, Tulika.
So looking at the clock, we want to be able to, highlight you and come to a close. And because, you are such a, amazing, just human being, not only you smart and brilliant, but you have so much to share. So we have some rapid fire questions. We're going to put you in the hot seat.
Are you ready for this? This is going to be fun.
We're going to put you in that hot seat. So Christine, you want to do your 5 and then I'll do my 5?
I say we alternate. Colin, we're just going to go at it. I think she can handle this. Let's just go, go fire left and right. Are you up for that, Tulika?
Sure. You choose to,
and don't even think about it. Just whatever comes to mind, just say it. All right. You ready? Okay. I'm going to start. Introvert or extrovert?
Extrovert.
Beach or mountains?
Beach.
Texting or calling?
Texting.
Early bird or night owl?
Early bird.
Sunrise or sunset?
Sunset.
Sweet or savory?
Sweet.
Preferred superpower, mind reading or invisibility?
Mind reading.
rom-com or thriller?
Ooh, let's go. Okay,
All right.
rom-com.
All right. And last one. Very, very most important question of all. Right way to hang the toilet paper, over or under?
Over.
All right. Bravo. Great job.
Yay!
Oh, that was so much fun. Well,
We want to highlight you because you don't know who is watching or listening. So it just gives you a little bit taste of who Dr. Tulika is and her fabulousness. So thank you so much for answering those questions.
yeah, and you are such a catch. And are you
Are
you ready to catch? Shall we let the whole world know?
You guys are so sweet. We
How,
have a lot of very, very cool and catch people in our group. So yeah, I'm just in very good company here.
If
So
you
kind.
want, Tulika, you can tell us if you want to share like what you're actually looking for and where in life are you?
Ooh, okay. Well, I'm looking for my forever person. Like, I have done the dating thing. It's like a path through this, like it's like, walking on the fire to get to that point. But, I'm ready for my forever person, and hopefully somewhere here. Like I don't want to move again, move a lot. And I just love Orange County. I just love Newport Beach, and work is here. Friends are here. You guys are here. My home is here. And I've learned a lot about myself over the years and evolved a little bit too. And so I think I'm ready to find that person and be patient, and not rushing into things, and just find someone to match my energy. And there's a lot of good people around, and I am an eternal optimist and romantic. So I haven't given up yet, and so I don't plan to. So I just I do believe in the whole magic. So we'll see.
Oh, I love that. So where would if someone wanted to reach out to you and get a hold of you, wanted to have a chat, whether talk about STD and HPV vaccine, or perhaps, pursue you and would just like to have some friendly conversations and see where things go, how would someone get a hold of you?
Okay, and thanks to you, Christine, who have created the WCR community and different ways of connecting with WCR. I am on the Facebook WCR SoCal, and WCR Facebook is the whole the big one, and then I'm also on WCR SoCal WhatsApp. Also, my email can be shared if it's just medical related, but you can also send me a DM for medical questions on those. I don't mind. Actually, a lot of my girlfriends do ask me questions. So I'm open to sharing my information and everything through those platforms.
And are you on social media, all the channels, or on Instagram? And then obviously you're on Facebook.
I'm not a social media person. I did open Facebook to be on WCR. So
I'm glad you joined us.
Yes, I'm definitely on that. I'm not a very social media person, but I actually work for the government. I write HIV guidelines. So social media is not necessarily considered super cool with the government. So I just, I'm not very active on that. You'll see, like, I just want to be part of the WCR community. That's why I joined the Facebook part.
Awesome. And we appreciate your participation and just being in the community and just sharing your energy. So we really, I hope someone reaches out, whether it's, exchanging, information, learning more, and just having a nice chat with you. So
thank you guys for having me and giving me this platform and highlighting me.
Yeah, and thank you for sharing such valuable information with us and educating all of us. Truly greatly appreciate you coming on to the show and also being part of our community as well.
And don't feel shy or anything, no stigma. I am literally like an HIV STD, doctor. And I, any question you have, practical or guidelines or anything, just don't hesitate. It's between you and me, and it's not going to be shared. It's like very private, patient to doctor confidentiality and everything. So just don't feel any kind of, stigma or taboo-ness. Like there's nothing that I have not heard, I think, in my practice, and I can handle any of your questions. So feel free.
Awesome.
Thank you for offering that.
Awesome. Well, thank you so much, Tulika, for spending the time out. It's been a wonderful, chat and session with you. On behalf of Christina and I, guys, thank you so much for watching and listening to this episode. If you like this, please like, subscribe, and share, and comment. And if you feel like this was a benefit for someone else, please let them know. And until then, on behalf of the team, bye-bye.
Bye. We'll see you next time, everyone. Bye.
Hey guys, thank you so much for watching and listening to this channel. If you enjoyed this, please like, comment, and subscribe. And if you felt like this was a benefit for someone else, please let them know as well.
As a reminder, this channel does not offer medical advice. All opinions expressed are ours and our guests only. It is for general informational purposes only and does not replace professional healthcare services. Please consult your own healthcare provider for any medical issues you may have.
Until the next episode, whether you're in and out of your scrubs,
please remember to love yourself and others and lead with kindness.
Bye.